lot on the list, but you don't have a choice. So I think it's going to help on that side. On the other side of the ledger, we're just saying you ought to have the public option. You ought to be able to choose something that's public. Let me make a point about public versus private. The debate about the bill has led people to believe that somehow this American system, let's forget about other countries, they're really not relevant. Okay? I know they are a little bit. Let's talk about America. America today has a dual system, basically. I'm not an economist or a healthcare expert, but I'll tell you my impression. It's a dual system. We've got about half, probably a little less than half, of Americans covered by government health care. We've got another half that's covered by private. We've got 45 million covered by Medicare right now. We got 60 or 61 million covered by Medicaid. We got almost 8,000, 7,800 covered by Veterans Administration health care. So you got about 115 million Americans over here out of 300 million total population. They're covered by these public government plans for the most part. You also have, as you mentioned, this children's health insurance, which is kind of government and kind of private, because the privates run the program, but it starts with government. Then over here you have a long list, tens and tens, if not, the estimates vary, but 150 to 200 million Americans who get their coverage through their employer or private. That basic dichotomy, 50-50 roughly, is government and private. That ain't going to change very much with this bill, with this legislation. Sure, it will change within. We'll force both to be more efficient. We'll force both to offer more options. We'll force both to implement prevention at long last. Stuff we've been talking to death and haven't done anything about in a big way. We're talking about quality on both ends. That basic dichotomy won't change. So that's going to be where we end up. But I'll tell you one thing, and I'll end with this. This is it. If we make a change here, that system's not going to change a lot in terms of the breakdown, but it's going to change a lot in how we deliver health care. But one thing I can guarantee you is that dual system, we keep going the way we're going, is going to run up costs for everybody. Government can't afford it. I'm positive of that. Private sector, talk to any CEO, what keeps them up at night? A lot of things, but principally health care. Small business that can't even begin to describe the measure. Farmers, people that we should treat with a lot more respect, are getting killed by health care, not to mention energy costs. So one thing we're sure about, we can agree on, is those costs are going through the roof, and there is nothing in place right now, nothing to stop it. So I'll stop talking at you and we'll take questions. Who's first and where are we?